Hi, I'm Anita Gupta from U of T's Postgraduate Wellness Office, where we serve residents and clinical fellows. And today I wanted to spend a little bit of time talking about the topic of coping with information overload, specifically COVID-19 information. But I think the things we're going to talk about have relevance to other domains as well. And this is a topic that's seeming to have a lot of resonance with who the trainees that we're seeing in our office individually or talking to in workshops, healthcare providers in general. I mean, to be honest, this is a topic that has relevance to everyone right now. But today, I really want to kind of focus on you as a resident clinical fellow, as a physician. And so the question that I'm asking people right now a lot is, do you have any time in your day when you're not reading, learning, talking about COVID-19? Right? And I'm quite mindful that the answer you may give may have changed a lot in the last week, in the last few weeks, in the last few months, depending what's happened. But I think it's a question that still has a lot of relevance. And if your answer to that question is no, I don't have any time, or very little time, then I think it makes sense to think about it a little bit, right? And be mindful of the potential implications that so much information might be having. I realize that as residents, as clinical fellows, there is so much information coming at you from so many directions. You must be getting information from your programs, from your hospitals, from PGME, from Paro, from public health. I mean, I don't know who else you're getting information from, but there's a lot of information. And there's a lot of changes happening very quickly, so you need to be on top of that. Maybe even in the same day, there's changes in policies or new clinical updates or changes in work. Maybe you're being redeployed or whatnot. And so there's a lot to stay on top of. In addition to that, there's so much information out there about COVID-19 and the expectations and the rules that the general public has placed on them don't apply to physicians necessarily. And so that can create a sense of discomfort as well with so much information. The other thing to keep in mind is that as a physician, you may often feel very responsible for disseminating credible health information to your personal circle, to other people. And I think it's important to keep that in mind. And so when we think of all of this, we can be mindful of what may be the diminishing returns or maybe even some of the possible negative impacts of the ways I'm taking in information, what I'm taking in, when I'm taking it in. So I kind of alluded to this idea that the rules and responsibilities are different for the public than you, or even from grocery store workers, for example. Differences in expectations about going to work as opposed to staying at home. And rules evolve, right? So feeling some worry or guilt about, you were following the rules 3 weeks ago, but the rules have now changed, and what might be the implications of you following those rules now, right? It's a time when there's so much going on that we're often impacted by thoughts of what we were doing in the past, how that impacts now, and what we're doing now, and how that impacts the future. That's a lot, right? Sense of responsibility to others as a physician. I talked about responsibility to disseminate information, but also what are the other responsibilities that you hold yourself to personally because you are a physician, professionally, because you are a resident or clinical fellow. But also by nature of you being a resident or clinical fellow, being mindful that you are also being impacted by skewed exposure, right? There's a skewed nature to the information that's coming at you in your feeds and your emails and your social media. So for example, you are more likely to hear about healthcare providers dying, right? Or, PPE related issues or whatnot. And this is the time when legal protections are changing, right? The rules guiding workload hours, type of work you're going to do. You may be doing something very different than what you thought you'd be doing this month. And there's a lot of moral distress, potential for moral distress on a lot of different levels. So why am I mentioning this? Because I think when some or all of this is happening, then when you are getting any information about COVID-19, it might be unknowingly piquing some of your concerns or distress about some of these other issues. And so I just want to help you be more conscious about some of this stuff when you're making your choices. So what am I talking about? Because obviously I am not saying don't read anything, don't learn about it, don't talk about it. Like that's completely unrealistic, right? There's a lot of information out there that you do want to know that's helpful. However, can we find a way to incorporate choice and limit setting on when you're getting information, what you're reading about, and how you're taking that information in? So let's talk about just a few kind of maybe practical strategies that might be helpful. And let's start with beginning your day. And this first tip is something that, my wonderful colleague Jay Lynn kind of mentioned to me. And I think it's so practical and so useful. So just imagine if you woke up in the morning and rather than this being the first thing you picked up, right, and getting from being bombarded with information, just imagine if you woke up and you made the decision to go to the bathroom, right? And brush your teeth, pee, take a shower, whatever you're going to do. And then you consciously, with an alert mind, made the decision to open up your phone or your laptop or whatnot and start reading messages. And of course, some things can be very, very important and very urgent, but everything can wait until after you've brushed your teeth in the morning, right? Also thinking about, we often use our phone or our social media as an escape. And right now, it's not necessarily feeling like such an escape. So thinking about how that information is coming to you. And so maybe thinking about if you want to read the news or go through more social media, almost setting a time in your schedule when you can do that. You don't have to do it when that time comes, but having a placeholder for it rather than just kind of just reading everything as it's coming to you or kind of making those decisions. This is a time when a lot of people are saying they're finding it helpful to maybe take apps off their phones, right? So that they're having to log in to read some information rather than it just all coming at them. Maybe even making some choice about what chat groups you want to be a part of or what listservs you want to keep, because there's so many, right? And it's also a time to get very old school, right? So for example, maybe putting an alarm clock in your room. So if you're waking up in the middle of the night and you want to know what time it is, rather than looking at this, where you can then get pulled into reading so much other information. If you look at an alarm clock, all you know is the time, right? And I want to be careful. I'm not demonizing screen time, phones or whatnot. This is a time when virtual interactions are so rich and so important. And, we can talk about that another time. And information is so important, but I'm just saying, think about how you're using it. Okay. So it's not so automatic. When you're about to access information, I think it can be helpful to ask yourself these questions. Am I reading this information to feel prepared or to lower my anxiety? And I just want to mention that prepared is not a feeling, right? Or do I need this to do my job tomorrow or the next day? And if the answer is no to that last question, then I think you can really make some choices about, do I want to take this information in right now? Is this something that I need or I want? So for example, this is just an example, but does knowing the exact numbers on the curve in your city or your province or whatnot every single day, is that going to impact what you're doing with your patients today or tomorrow? And if the answer is no, then I think you can recognize that maybe there is some choice that you can put in place about some of this information. I mentioned about recognizing the potential skewed nature of feeds as a physician, being mindful of what information you're getting and what information you might not be getting. So, as I mentioned, what I'm talking about here is aiming for more choice rather than I must read or I can't read. Okay. This is not about eliminating all COVID-19 information from your life, right? Or conversations. So what can we do? Okay. So here are some things you can think about. Maybe consider the roles that you feel obligated to play outside of residency. What do you feel obligated to do in your personal life because you are a physician, because you are a resident, because you're a clinical fellow? So maybe it's, I feel obligated when friends and family or people that I am acquainted with write to me asking about what's happening in the hospital. What do you think of masks? What should I do? You can think about, do you need to be all things to everyone in terms of providing information? And this is a time when there is a lot of credible information that's already available for non-medical professionals. And I think you can keep that in mind, right? Maybe there's a few credible sites that you send people to, or maybe you're conscious of which people in your life you want to have these conversations with and which people you don't. I mean, I think this is a time when people are asking these questions and doing it out of, you know, a good place and out of innocence, right? Like, have you read this thing that's really helpful for doctors to do to stay safe? You know, people are sending this out of concern. But when you have so much information, that can really add to things. And so thinking about the impacts that that has on you specifically can be really important. And I think it also brings up this idea of maybe you can think about communicating to your family and friends about your needs with respect to COVID-19 discussions or information generally, right? In terms of, hey, like right now, just everything that's coming at me is COVID related. And what would be really helpful for me, what would feel really supportive is if we could have some non-COVID related discussions, for example. Or, hey, like I have no time to look up good workout videos or whatnot. Could you help me look at that stuff? And I think family members and friends often find it very helpful to know what would be supportive for you because they want to help, right? And so having that information can be helpful. Also, I think it's a time when being creative about how you're socializing can be helpful. You know, so let's say all of your friends are also residents or clinical fellows, are also physicians, healthcare providers. Then really thinking about, okay, when we're having, you know, our Zoom virtual hangouts or whatnot, you know, maybe we could, I don't know, spend 5, 10, 15 minutes talking about or doing anything unrelated to COVID-19, right? And so what does that do? So a number of things. So in some ways, it lets people at the end of the time opt out, right? If they don't want to have any further conversation. It also allows those people to stay in, right, if they want to. It also means that the conversation has kind of naturally come to something. And so the conversations that you're going to have are maybe going to be more relevant, right? Because I think right now, it's just become so automatic to talk about COVID. If I ask you, hey, how are you doing? It's almost interpreted as, how are you doing with COVID? Right, and so I'm fine has been replaced with, you know, whatever. Oh, this is what's happening with COVID, and so if we can be a bit more mindful of how we talk about it and not be so automatic about it, then I think the conversations that you do have that are related to COVID-19 and how it's impacting you and what you're doing at work or whatnot become more relevant, right, and more helpful or more what you need, what you want to talk about. And so, in that vein, you know, if we think about reaching out for support or supporting your loved ones, here's another question you can ask yourself, because sometimes it's COVID information overload, and sometimes it's COVID information overload coming in and then not talking about what you're going through at the same time. Because of that, I don't know, for some people, you have that responsibility. I'm the one who has to quell worry. And so, you know, this is an important question to ask yourself. Am I trying to protect loved ones from worry? Are my loved ones trying to protect me from worry? And I think back to the work that I've done in cancer. And oftentimes, you know, you'd see someone who, let's say, is the identified cancer patient. So, you know, I don't want to talk to my family and friends about this. They have enough going on. I don't want to burden them more. Or family and friends, you know, I don't want to burden, you know, the identified cancer patient with any more. They're going through enough. And so what happens is, like, everyone is worrying, right? But no one's talking about it. And so you don't even know if you're worrying about the right thing. So I guess what I would say is that, you know, yes, you are a physician, but you are also a human being. You're also part of your family. You're also a friend. And it makes sense if you're feeling worried about things. It's okay to talk about it. It's okay to ask people kind of how they're doing. And so I think if you can open up that communication, if you want to, right, with the people that it makes sense to do that with, um, you're not going to not worry, but at least you know you're worried about the right things, right? And I think the other thing is, if you are talking about these things, then you're more likely to be talking about other things. It's sometimes hard if you shut down conversation about one particular topic to really talk openly about other things, right? Um, and so I guess, you know, I just want to go back one slide and just say, also in terms of this being creative and speaking to family, friends about what you need, is that I think it's important to remember that not every conversation, not every Zoom interaction, not every communication that you have, it has to be so heavy and so meaningful, right? And so that might be a way of being a little bit creative. Like maybe whatever you're going to use, um, what's it called? That house party app or whatnot, and you're going to do some Pictionary for the first 5 minutes before you kind of check in with each other about what you're doing. Whatever that is, you can be creative. Anyways, I hope that gives you a little bit to think about. As always, Jaylin and I are both available if you want to come talk to someone individually about these issues. And thank you for what you're doing, as always. Okay, I hope you have a great day.